Welcome to Pacer Nursing Power Hour, your go-to spot for real talk and real tips in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour, where nursing students get powered up.
Yay! So this week is super special.
Okay,
I'm
this-
saying something other than excited because I've said excited every week,
I know.
and I'm
but
just as excited.
this episode, I feel like kind of spun off of that that Insta thing we did at the end of the semester where the mannequins came to life. You either loved it or hated it. I mean, that's been the highest grossing viewed video for School of Nursing.
That's
Yeah,
great.
like 5,000 over 5,000 views. Yeah, it's insane.
So we're titling this episode "Surviving Sim Lab When Mannequins Make You Sweat." We have discovered that students go into the sim lab stressing, and it's really not a stressful area
I
at
don't get
all.
that.
So
It's uncomfortable, but it's
maybe.
not stressful.
But we have brought you Rachel Wilson, your USC Aiken Sim Lab director. That's your term, right?
That's my term.
You're officially
That's my
Sim
term.
Lab director.
The best I've ever seen anyone do at this.
And she gets to play with the coolest toys every day.
I do.
I
do.
I love you, Rachel.
Jesus Christ, she's not going to ever take enough credit for
She's
herself.
never.
Because her scenarios are some of the most intricate, like, oh, that's pretty cool.
Yeah.
Like, even as an instructor, I'm like, oh my God, that's cool. That's a great idea.
So what made you fall in love with, are you in love with simulation? So what made you fall in love with simulation initially?
Initially, just the concept of it, just the ability for the students to practice as a nurse. It's really the only opportunity they get in nursing school to independently practice as a registered nurse before graduation. They call all the shots. They make the decisions, good or bad. But they get to practice independently. As a kid, like I was the kid that played house all the time, so I'm a really good pretender.
I love that.
You're a very good teenage girl.
I like to pretend.
She's a very good teenage girl.
I love sitting behind the glass with you. You're
really
so
fun.
good at being all the patient.
It's really fun. You get to act a little, improv.
Mm-hmm.
It's fun.
So for anyone listening who's never gone to SimLab, some of our listeners are seasoned nurses, but they may have gone through school so long ago that they didn't have this experience.
We didn't have SimLab.
We
had mannequins that just laid there, but they didn't
interact.
Nothing.
So can you give our listeners a behind-the-scenes breakdown of what SimLab is and why it plays such a big role in our nursing education now?
Yes. So SimLab is high-fidelity mannequins. We have a variety of mannequins. We have adult female. We have adult male. We recently acquired a pregnant female.
I'm so excited.
Do not say that word. Do not say that word.
What word?
Vagina. Thank you for asking. I was waiting for a segue.
She
Vagina.
can deliver babies. She can have shoulder dystocia. She can hemorrhage.
Oh my God.
She is really, really cool. We have pediatric mannequins. We have hospital settings. We have community settings. And we have two-way mirrors where I can see the students, but they cannot see me. Hopefully reducing some of that anxiety.
Mm-hmm.
They can't see me on the other side playing the patient.
Yeah.
So we have cameras all over the room. We can see different angles. We have audio. We can hear the students, even when they're whispering to one another.
Mm-hmm.
They think I can't hear them. I can hear them.
Oh, I can't wait to get into this.
Well, I was lucky, and we did have SimLab. I went to this program, and we had
Dr. Lawrence
a few SimLab interactions, and I kind of felt the opposite. I kind of felt once our adult, like our instructor or whoever left us, we all kind of like stood there and was, okay, are you going to do something? Am I going to do something?
That's still seen, I think.
Yes,
like
very common.
What now? Because they normally are the person that tells us what to do. What do we do now?
Right. I think like the lower levels definitely have more trouble deciding who does what can we do, what are we allowed to
Mhm.
do. But that's the beauty of SimLab. You can do whatever you want. If you show up in your uniform with your prep work done, you are not going to fail.
True.
So you can do whatever you want. It may be the wrong thing, and we'll talk about it,
Yeah.
but it's a judgment-free zone. When we do have to discuss students doing the wrong thing, I do it very gently.
You do. You're
She's very
amazing.
PC.
Yes.
We just talk it through, and hopefully the student leaves thinking, okay, I won't do that again. But I understand why
Yeah.
I did it.
Mhm.
Hopefully they understand why they did it, and hopefully they understand why they shouldn't have done
The other
whatever
thing.
the action was and know what to do better next.
So, we often tour students. When I go into that sim lab room, I go, okay, this is where you get to kill your patient, and it's okay.
Well,
But this is the only time.
I hope that they don't kill the patient, but it happens.
Yeah.
It definitely happens.
Well, one group last year took what 2 minutes to start CPR
Yeah.
on someone
Yeah.
who flatlined.
Love it.
Unfortunately, sometimes their reaction time's a little slow. But hopefully after debriefing, they're like, okay, I will never do that again.
Yeah,
I will jump right in next time.
I think that group now I kind of shocked them back into reality.
So I have a question. Kind of getting back to group work. Is there ever a simulation where there's only one student in there?
So that is my goal. I really would love
Ooh.
to add that for level 8.
That would be
Just
cool.
prior to graduation, them have a single student sim. Um, prior to this semester, staffing's kind of been an issue and
Mhm.
room availability. We just have so many sims going on.
Yeah.
But that is an ultimate goal for me to have a single student simulation.
That's cool. I never even thought about that. What do you see in your head that looking like?
So we have, beside the community rooms, we have an empty room. I would
Mhm.
like to put a bed in that room and have it an actual patient room
Cool.
and have the student take care of one patient in that room on their own. Don't know what type of scenario.
Mhm.
Ideally, I would have 4 rotating scenarios because the students are likely going to talk.
Talk.
Right. And so they don't
Yeah.
know what they're coming into.
Beautiful.
By level 8, they're almost ready to graduate. They don't really need the prep that level 4,
Mhm.
5, and
Yeah,
6 need.
Mhm.
They they need to be able to walk into a situation and pick up a patient with an unknown condition without having researched it, without having researched
Mhm.
Yeah.
the meds, because that is more real life
Do it on the
scenario.
fly. Yeah, if there's something you don't know, you need to find the answer.
So I would like to see that happen, or even a multi-patient sim where the
Mm.
student comes in and they have 4 patients and just
Yes.
prioritizing.
That's huge. Those are serious skills that you learn in your first
for
year.
some
So if
reason,
you could go into your first year already having a little bit of
I
concept.
think it would really increase their confidence. I think it
Oh,
would be
yeah.
extremely anxiety provoking at
Yeah.
first, but I think it would be a huge confidence booster for them to say, "I did that by myself.
I
yeah,
I
agree.
did that."
yeah,
I support. I think it's a
yeah.
great
Yes.
idea.
I'm in
So that's
favor.
in the pipeline. I'm working on that.
That's awesome.
So in these group settings, do you typically see one person just naturally take the lead, or do they kind of divvy things up amongst themselves, or
Both.
both?
There are definitely natural born leaders,
Mhm.
and I see these students stand out every single simulation they're in, and they're like born to be a charge nurse.
Yeah,
You
Mhm.
can see it.
we can spot. You can
You can
spot
see
them.
it. Yeah. And then there are others that are not comfortable and they're quiet and they're reserved and they default to the group.
Mhm.
The group dynamic's really important. Sometimes you have students come to you afterwards and say, I don't feel like this is a good group for me.
Mm.
The dynamic is important.
It is.
Absolutely.
And that's the same thing when you get your first job and you're on a unit. If you don't mesh with that unit,
Right.
that can make or break you.
Yeah,
And that's what I encourage the students. You never know who you're going to be working with. So you've got to find a way to make it work. Even if your dynamic, your personal dynamic or your work dynamic is not great, you're going to encounter that.
Mm.
So we're just going to work through that.
yeah.
I've never thought about
That's
that
a
with
great idea.
simulation, but that is a fantastic point. I love that.
Absolutely.
I
Well,
love
they're
that.
making their own decisions for the first
Yeah.
time. And so they're in this setting. They have orders, yes, but
Mhm.
they're making nursing decisions. Where in
Mhm.
clinical, they have so much more guidance. And
Mhm.
so one student will have the feeling like we need to do this, and another student will be like, no, we can't do that because of this. And there'll be, some tension there.
Sure.
But they need to learn to work through that.
That's big.
Yeah.
Oh, I can't wait. Yeah, we need an open house.
Okay.
Yay.
Let's do it.
Okay.
What's one of your favorite moments when a student completely forgot the mannequin wasn't real? Has that ever happened?
I don't know that they ever completely
Yeah.
forget that the mannequins aren't real. A lot of them have a really hard time with the mannequins. They're very creeped out.
Okay.
You could tell who played house and who didn't.
Our chance Dr. Heimerman, he will not go in the sim.
That's funny.
It freaked him out
But
that
you
first
have a
time.
lot of students who really connect with the moment, and you
Yes.
like can believe that they're taking care of a real patient because they're really good at connecting. And then you have some that are just like lifting their
Doo-doo-doo.
arm, playing with the mannequin because they're
Like,
just
I'm envisioning that screen of like fail, with
Yeah.
an X. Yeah.
Are there any particular simulations that tend to do that frequently for students? Like, is there any scenario that really just kind of pulls them in?
I would say probably the peds scenarios, they're able to connect a little better.
Interesting.
They seem to be. Um, in one scenario, we have an infant
Mhm.
who there's questionable abuse, and they connect well with that.
Ooh.
You see the male nursing students who you've never seen interact with babies, patting the baby,
Who
talking to the
swear they don't
baby.
want to take care of a kid and
Oh.
are just like, or just white when they walk into clinical, but then they get into sim lab and this completely different person.
And then sometimes you
Wow.
see other males that are like, hush, baby.
They're there.
Yeah.
Oh,
They're there.
They're there. They're
Don't
there.
say his name.
They're there.
They're there.
They're there. We had
They're
one
there,
student. That's
baby.
what he said.
They're there.
Yeah,
We were
That's
laughing for
fantastic.
weeks after that.
they're there. That
That's
fixes everything.
So if you're listening and you know who this is, yes, we're not saying your name, but it's still in the air.
Still a favorite.
It is still a favorite. They're
Now, you mentioned a code blue scenario. Do you do a code blue every semester?
We do several code blues.
Woo!
Um,
I'm so glad that's not me.
we do several code blues. We
we-
do unexpected code blues at time.
Ooh, little
so-
curveballs.
Little curveballs. We've had some insulin overdoses, some morphine
Mhm.
overdoses that ended up with code blues when
Because if a
correct
student
dose
does
wasn't
make a
hit.
mistake, you have the mannequins react appropriately, correct?
Absolutely.
Well, they just
That-
die.
So if the order for morphine is 2 milligrams and they give 20 milligrams, they need to feel the effect of what would
Mhm.
happen. It's not a punishment for them, but they need to see the real life consequence of having done so.
You're so good at that.
It's really up to the student as to how many code blues we see.
Okay, so I don't know if you have this in here, but disclosure, you just got a Pixis for the sim.
Oh yes.
I
excited.
am uber excited. Are you going to create a scenario where someone has to override a drug and it's
Oh
the
yes, there
wrong
will be
drug?
override.
Yeah.
That
will
is
be over.
huge with the recent history in nursing with
What's her name? Redonda?
Yes.
yeah.
That was the fatal overdose.
Yeah.
Yes.
Becuronium
Yes,
instead of Versed.
yes.
That's huge. I mean, these are career skills that students are already getting lessons from before they even jump in with a license behind their name. So that's huge. You're amazing.
I'm super excited about the Pixis.
I know, me too. It kind of blows my mind.
What has been your favorite Code Blue memory?
As far as humor or
Either.
Okay, so one of my favorite humorous code blue
Okay.
is the students moved the bed away from the wall
Okay.
and they were getting ready to start compressions and they didn't lock the bed back.
Oh no.
And one of the shorter students hopped on the bed and it flew across.
Oh my God.
Yes, it was funny. It was very funny.
Wow.
We
But
felt-
that, I mean,
It
that
saved
can
life.
happen though when
How
you
did they
are just
react?
rapid fire trying to react, because you do in real life, you generally do pull the bed away so that someone can do ventilations at the head.
I
And
always
you can
It
forget
has
that.
become part of my teaching moments too.
I
say,
love it.
there's a lot of things you can do to help out in a code blue situation. Pull the bed away from the wall so that we can get behind it.
Lock
the
it.
bed back. It's very important. Another code blue moment that I loved was hilarious. They were trying to rip the gown off the patient to get to her chest, and one student punched the other student, trying to get the gown off. Yes.
But you're all up in it when you're in a
Oh
code.
my God.
There's so many people in such a small space.
Yep.
That
Wow.
is cool.
That's something I teach. I'll go in for orientation for Dr. Edwards's class, and they practice compressions. You roll us a mannequin in, we practice compressions, and I always tell them, "Step 1, take everything off. Otherwise, you are flopping your ponytail. If you have glasses, they're on the
Oh, you
patient.
mean take off
You
your
have
body,
your
not the
badge."
patient.
Yeah, your badge is slapping you in the face. And I'm like, those are things until you haven't done it the first time,
Yep.
you don't
They're not
know.
muscle memory yet.
But yeah, that is so huge with simulation to learn those little baby
So,
steps.
how did the group when the bed rolled away? What did they do?
They laughed. We all laughed. And then we locked it and kept going. I said, "Don't move it back. Lock it and go.
Let's
Like,
go.
we don't have
Yeah,
time to
yeah.
put it back where it was.
Mhm.
Lock
That
it and
is
go."
So
so
cool.
funny.
Yeah.
Have you ever had difficulty? Are you okay? Let me rephrase this. Are you good at the poker face?
Oh God, I can answer that.
Yeah, I think so.
Yeah.
I think so. I'm good at sneaky little things.
Okay.
Very sneaky little things. Sometimes, without giving too much away, because I don't want students
Yeah,
listening
you
to
don't need
this
to
who
know the
haven't had
secrets.
these simulations before. But blood can appear, and I may have to go out there and do it and
Mhm.
make the blood appear because the
Mhm.
mannequin just can't do it.
Bleed spontaneously in a place
Correct.
that's not.
And I can do things like that without them always noticing that I've done it. I have
Mm.
some distraction techniques that I've learned, and
Ooh.
It's magic.
I'm sneaky.
Nice. So it's time to walk down memory lane. I don't know what this is about. Time to walk down memory lane. We're going to talk about funny moments, behind the scenes mishaps, and more sim lab bloopers. So, I feel like we already asked this. Okay,
Yeah.
what is the funniest thing that you've ever heard a student say during simulation?
Oh, there
There
are
has
a
to.
lot.
There
Was good.
there has
There
to be
was good.
top that.
So I really work hard to increase the realism always. And so I had a patient in a soiled diaper and I used the odor spray.
Oh my
I did not
gosh!
even know we had odor spray.
All the senses.
Oh, it's really bad. It's really,
It's
really
like
bad.
C. diff
It's
bad.
really bad. And so
I had no idea.
it was worse than I anticipated. And so the students
It was
were
worse than I
the
anticipated.
students were taking care of the patient, and one of the students said, "What did you eat?" Yes. So we talked about it in debriefing. I'm like, yeah,
Professionalism.
yeah, that would really embarrass your patient. Let's not say that to the patient. You're gonna
Now,
have.
during the simulation, did you answer?
I don't remember.
Okay.
Honestly. I think I was.
I wasn't
laughing
sure
too
if
hard.
you.
Yeah, I mean,
I think I was probably on mute, so I was.
I was.
laughing.
Yeah, no, there's no way I could react to that. I just laughed. That's so funny.
Do you have a memory or do you remember any time where you, as a director in the middle of a simulation, have messed something up?
Absolutely.
What?
Absolutely. When you do this, so a lot of days I'm doing the same scenario back to back to back. Every 2-hour group, I'm doing it twice. So at the end of the day, I may have done it 8 times.
Oh,
There have been times where I've just mentally checked out. And the students are asking me a question as the patient, and I'm like, just checked out. And I'm like, oh, gotta reel
my
it back in. Gotta come back. I'm sorry. What did you ask me? I fell asleep for a second.
You need to put those on audio, like record them and just
Well,
let it run.
You can set these simulations up to run on their own. You could do like an auto where there's just auto things that happen. The vitals change after a certain number of minutes and things like that. But I don't like to do it that way because I like to really adapt to what the students are doing. So if I put it on auto and they're not doing the correct actions, but the vitals are improving, it doesn't make as much sense.
Right.
So I like to do them manually every time. A lot of simulation labs do run a lot on auto, but I just have found that I have better experience manual. So
it seems more fun,
you
too.
can't check out mentally though.
Well, I
you
mean,
have to be there.
Yeah, but
Present.
we spent many episodes talking about personalizing their education, and so
This is it.
That's it right there.
This is the.
Where you can't necessarily ensure that X, Y, and Z will happen in clinical, but for
can.
the love of Pete, it will in sim lab. So I love that. I wish we could do like more. So, Claire goes to another school. They have a 50-50.
Yeah.
They do sim 50% of the time and then clinical hours.
I think there's a lot of value in it. I
Yeah.
think you can really provide them experiences that they're never going to see in the hospital until they've been practicing a while. But those once in a blue moon things that are really important to see.
For
Yeah.
sure.
But you can't manufacture them in the clinical setting. So
Well, yeah, in the clinical setting, in certain areas especially, it's not consistent. You can't rely on a hemorrhage happening in a
Right.
semester or a shoulder dystocia
Or even
happening.
a vaginal birth.
Yeah, or even a vaginal
Right.
birth. You're right. Last semester, one group had one delivery.
Right.
I
on their
never saw a
shifts.
delivery. Thank the
That's great.
Lord. I would have like, I'm out. Peace out.
Have
No.
you ever used an accent?
I have not used an accent. So
I
use
want you to
different
use an accent.
voices. So when I play the child, I try to use my
Okay.
child voice. I've actually had my 11-year-old play the child once before. Yes,
Really?
it was pretty funny.
That's
She did
cool.
a really good job.
Charlie's awesome.
Sunny would love to do something
It
like
is
that.
fun. It's really fun. I use different voices, but I've never used an accent.
Okay.
But
I can't have. Do you have an
I
accent
do
that you go
not.
to?
I've
I'm
not.
Oh, I
too
think you
Southern to
could.
have an
Yeah,
accent.
I think you
don't.
could.
Do
I don't
you
think
have an accent?
I mean,
What's your accent?
hello.
That's just one
Hello,
word.
Kennedy. Would you like to get a cup of tea?
Okay, so is that
I don't
Southern
know.
England or
Yeah, I don't
Australian?
know.
Where are you
I
coming
don't know.
sister?
Somewhere else, I don't know. Far, far away.
Yeah, I can only do Southern.
Yeah, me
I only
too.
speak
I don't
Southern.
have accent
Okay.
skills.
Sometimes I don't even
So don't
speak that
expect
well.
accents.
Okay, which mannequin is the most high maintenance?
Every one of them.
They
I think
each
you experienced this last semester. So they all have so
Oh my
many
god,
wires and
parts
mechanical
that you don't
parts.
know.
And
You
I
have to-
am no mechanic, but I'm learning to be.
Oh no, you
I
should.
can
That's like us
dissect
doing a
these things.
podcast.
I disagree with that
I can
statement.
dissect now and surgically repair
Love
most
it.
of their inner workings. There's a lot.
Nursing at
There's
its
a lot.
finest.
So the ACLS scenario, the mannequins are built to be compressed on, and we actually Rachel can tell them, even show them how deep they're going. But some of them get into it so much it knocks a wire off, and so it stops working, and you have to go in there and perform
You
open
lose
heart
that
surgery.
communication, and you do have to perform surgery.
One of my mannequins, her cervix will pop out when you do a
Yeah.
cervical exam if you like push
Yeah.
too hard or push the wrong way.
Again, that's why I don't do maternal.
Pro, it's
Yeah.
cervical relocation.
Yeah.
You need to add that to your resume. That's so funny.
Speaking of high maintenance mannequins, there was one semester where my students had to do a makeup sim and for hours. And it was just kind of a regular checkup or something.
Prenatal visit.
Yeah, prenatal visit. But she had breast implants. And she had all these questions.
Did we have breast implants for that? I mean, basically they are breast
So
implants.
they do have interchangeable breasts.
Augmentation?
Yes, they have different breasts. We
Can
can
I use it to put in my
No,
mouth?
you may not. But this particular patient that Katie was talking about, she was very bougie.
Yeah.
This
She
patient
was very
written
concerned about
by-
breastfeeding.
Yeah,
Very
Kelly Russell
concerned.
wrote that patient scenario, and she's fun.
Yeah?
It's a very fun patient.
That's so
Bella
funny.
is her name.
Bella Bougie.
Yep. you got
Okay,
it.
I get that.
Yeah.
Oh, we need to take a
She's-
picture.
Have you ever had to
Yeah.
reboot a mannequin in the middle of a sim?
Very often.
It
Very often.
happens.
Our older mannequins, especially the baby, she likes to act up. So I have to
Oh.
reboot her at times. But we just
Gotcha.
go with it.
I mean, but
Hey.
what baby doesn't need rebooting
True.
every once in a while?
I need
True.
rebooting a
Yeah.
couple times a week. So
Okay, what's the one sound or feature that always makes students crack up?
probably the gag. They like the gag. It's pretty funny.
Does it make a sound?
Yeah, oh, yeah. It's
Can you replicate it?
Oh, I do remember that. I think I've heard some what's the word?
Explicative?
Thank you.
Bad word?
Yeah, come out when that happens.
It's kind of loud and it
Just disturbing.
Yeah.
Like,
Just
yeah.
randomly.
That's funny.
Love it. Okay.
So we can agree simulation for students can feel stressful.
Absolutely.
But Kennedy and I talk about all the time that there is positive stress. Is that
Absolutely.
how you view simulation?
Yes. So there are a lot of studies that show that a manageable level of anxiety is very productive in SimLab. You
Yep.
don't want them to come in and just be like, oh, whatever happens, happens.
Boop-a-doo.
You want them to care. but you don't want it to be debilitating anxiety.
Yeah.
You want the more facilitating anxiety. So, in pre-briefing, we kind of talk through, what they're nervous about. We go through the whole psychological safety.
Mhm.
What happens in sim lab stays in sim lab. We're not going to
Mhm.
talk about each other outside of sim lab. We're not going to go and say, "Hey, you won't believe what Kennedy did today." Um,
I bet they
she
do that.
tried to give a medication rectally that wasn't, it was an oral med. So I really reinforce that quite frequently. Whatever
Yeah.
happens here stays here. I'm not behind the glass laughing at you unless you said something really funny.
Yeah,
And then I'm laughing with you, not at you.
Yeah.
I'm rooting you
definitely.
on back there. I want them to do well. I have pride when they're doing well.
Mhm.
So I really try to ease that anxiety, the more social performance type anxiety. Um, but I want them to have some medical anxiety. I want them to have some anxiety about, do I know how to do this correctly? Can I perform this procedure correctly? Am I giving the right dose? Because I want them checking the meds and doing things as accurately as possible.
Yeah, that makes
I
sense.
mean, it's just, I mean, I, I, I was in a simulation at one point as a student, and I remember it's just awkward.
Yeah, it is for a lot of
It's
students.
so awkward. And getting past that awkwardness, what do you see students do to get past that? This is a random question. Sorry.
Um, I really don't know how they get past that, honestly.
They just jump in and
I
do it.
think just repetition. The more they do it, the less they feel that
And they get it a
awkwardness.
lot through our program.
They do.
Like, how many times would you say a student in one semester comes to SimLab?
It depends on the level. Level 4, they only get one true simulation. They get the 202 that are, I guess they are simulations, but they get one mannequin simulation where they're the nurse there and it's more of a traditional patient.
Mhm.
But by level 5, they get 5 or 6 sims. Level 6, I think they get 4. Level 7, they get probably 8.
Wow.
And then level 8, they get, I was counting these the other day for a student that was asking. I think they get 7 or 8 in level 8 as well.
That's
And I would
incredible.
love for them to see more and
More.
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 Absolutely.
Yeah.
Yeah.
Have you ever been in a debrief that was particularly rough?
In what way?
Like,
Emotionally
the
or
students
yeah.
were really down or really were maybe triggered by the scenario that you had to, at the debrief, really bring everybody back?
So I would say a lot of debriefing starts with the students feeling down. They
Mhm.
sit down, and a lot of times they don't even necessarily know exactly what happened or why things happened, but the goal is that we talk through it during debriefing and they leave with an understanding. So typically they leave feeling like, okay, yeah, I messed up there, but that's a common mistake.
Yeah.
Mhm.
This is what I need to do differently. Or, oh, now I understand why that was happening. I'm not dumb. I just had not figured that out.
Yeah.
Um, so I would say they typically start out, we we always begin debriefing with feelings. Like, how do you feel about that? What do you feel like you did well? What do you wish you'd done differently? And a lot of times in that first few minutes, they're like, oh, I did
It's like
horrible.
crickets, though, sometimes.
Sometimes you have to force it
Sometimes.
out of them.
Yeah.
But I don't think that they typically leave feeling defeated. I think they typically leave understanding why things happened, understanding how they could improve it. My goal is never to make them feel beat up when they leave. I
Yeah.
want them to leave with confidence.
What's your favorite light bulb moment that you've seen in a student?
Light bulb moments are really pretty common, and they
Oh.
usually happen in debriefing. Um, One of the scenarios I would say I see the most light bulbs is the pediatric ALL.
Mhm.
Um,
And I will say, of all the years that I have done adjunct and heard about when you started the ALL, that would be like my least favorite. But I hear the students love it so
they do tend to
much.
really like that one, and it's really complex.
Okay, AL for people who don't know what ALL is.
It's leukemia.
Okay.
It's childhood leukemia, um, which Kay Lawrence wrote that scenario when she was here, and we've done some adaptations to it, but it is a favorite scenario, and they learn a lot with that one. It's very complex, and they don't understand why things are happening when they're happening. Debriefing is a huge light bulb moment. We kind of talk through the whole scenario, and they're like, "Oh, it all makes sense." And
That's so cool. I love it when that happens. I used to love it when that happened on the floor.
yeah,
Like, can you see it?
Well, when I was doing clinical for peds, we would do this ALL scenario in SimLab, and so often we would see that patient.
Up on the
Like,
floor
you
on
would see
5.
it was just a
Right.
very common sequence of things for an ALL patient. So we would see that patient, and I'd be like, "It's Blake," and they're like, "Yes, it is."
Do you think having the, um, the high complexity of the scenario made it feel realistic, and that's maybe why students really enjoyed it?
Yeah, maybe, but I just think it really that particular scenario makes a lot of things make sense for them.
That's
It's just
cool.
seeing.
Is that at the beginning or that's at the
So I usually
in the
time it
mid with
prior to
oncology?
their learning of it because I've surveyed the students. I've done it
Mhm.
both ways. I've done it prior to the learning the HEMOC unit,
Mhm.
and I've done it after. And I've surveyed the students, and they typically like it before. It makes the simulation harder because they haven't had the lecture yet,
Mhm.
but it makes the lecture it light bulb.
Click.
Right. When they get
I
the lecture, they're
love
like, "Oh
that.
yeah, we saw that happen. We saw this. We saw this play out." So
Well,
That is
this is
super cool.
another prime example of something we talk about frequently on the podcast is that students, I know this sounds kind of cheesy to say, but they play such a big role in how our program is developed and designed. And our faculty are so good at adapting what we
Using
teach,
their feedback.
using their feedback
absolutely.
and building upon it and doing what helps them. We are here for them. And so I love hearing that.
I really push that survey at the end of every simulation. I'm like, guys, be honest. You don't have to tell me that everything was wonderful and that you loved it. Some of you are never going to love them,
Yeah.
but tell me what was effective. Tell me what would make it more effective. Like, I really use these surveys to change things.
Yeah.
Have you ever had a student or a scenario or a situation that has made you emotional or given you goosebumps or been
We have
powerful?
tiers at times. We did a new simulation over the summer of vulnerable patients, and it was
Oh,
a
now I heard about this.
homeless patient. And in debriefing, we had some tears. The
Really?
students really connected to this patient's plight, and and there were tears. So that
Oh,
always it.
Wow.
Of course, I don't want to make anyone cry,
right.
but seeing a student connect like that, you're like, okay, this was effective. This
Yeah.
Yeah.
That is a simulation right
right,
there.
right.
That is fan freaking and I love that idea. That's awesome. Okay. All right. So, how do you think for simulation students that it prepares them for real moments in when in their practice?
Kind of like we talked about at the very beginning, this is really the only opportunity as a nursing student to be the nurse independently in simulation. You go into clinical and you get to do these real life things, but you don't really get as many decision making capabilities. In SimLab, you're the nurse. Like, you make the decision, you
No.
call the shots. And sometimes we're doing things that we don't have orders for. And
Mhm.
sometimes we're doing things that are not within the scope of our practice. And so it's a good time for those mistakes to be made so we could say, "So, what made you think you could put a chest tube in?"
Yeah.
Not really.
I
But
know,
No,
seriously. Yeah,
but
what made you?
the vein, a lot of them wanna go for that
for the
vein.
jugular, they
I'm like,
wanna.
"Dude, that's not in your scope."
Right,
Mm,
right. So, it's the perfect opportunity for these mistakes to be made. I don't even remember what
absolutely.
the question was,
No, it's
honestly.
Yeah,
good.
no, we lose it all the time.
You know if any of the hospitals in our community close by use simulation for training in their hospitals regularly?
Yes. So we have partnered with Aiken Regional, and we
We
are
do.
offering simulation for residents. We've been doing internal medicine for the last year, and family medicine actually starts this month as well.
So
So
cool.
it is a simulation for the residents. That's the
Mhm.
primary purpose of it, is for the residents to get the practice, but we have integrated our students into it. So they are working for the resident.
Alongside them?
Absolutely. So the resident is coming in, assessing the patient, doing an H&P, trying to figure out what's going on, and they're giving lab orders to our students. We need to start an IV. Let's give a bolus. Can
That's
we
so
give?
cool.
It is really cool. So I try to prepare the simulation using what I think the physician should order,
Mhm.
but it's all happening on the fly. They may order medications that I don't have prepared, or they may order procedures that I did not planned for. So
Anticipate.
it's a really cool experience for our students
That's
and for the
neat.
residents.
I'd love
Now,
to
do
come watch
you
that.
find our because it's level 8 students that go in there with them, correct?
Correct.
So, do you find them leading the residents at
At times,
times?
absolutely. Especially as the new residents come in for the first couple times, you definitely see that. Um, I've even had the attending say, have your nursing student take over CPR or,
Oh my god, that is so cool. That gives me goosebumps.
but they're all learning. So it's the residents are learning, the
Mhm.
students are learning. They're all new to the,
That's
to,
beautiful.
yeah, it is really cool.
That's so cool.
Yeah, I would love to see the nurses across the street come over and
Yeah, that
start
would be really
them start utilizing,
Well,
but we need more space.
that's my next question. Do you think as nursing progresses, should students, once they get into their career, should they anticipate training with simulation within their job?
Absolutely. And a lot of hospitals are.
Yeah.
They're running mock codes
Mhm.
with simulators, and a
Mhm.
lot of hospitals are continuing simulation
Good.
as continuing ed.
Beautiful. So we do a lot of our podcasts with this segment called Stethoscope Hot Takes.
Okay.
These are rapid fire questions.
Don't think about it, just
Yep.
answer it.
First
Okay.
thing that comes out of your mouth, go for it. Okay. Coffee or chaos? What would you choose?
Coffee.
Love it. What's your go-to order?
Oh, I like regular coffee with oat milk. Just no sweetener.
What is up with all these people with not
I like
Because we're normal.
I like black coffee.
We're normal. We're not bougie. We don't.
Ugh.
Coffee is hot, not cold.
Yeah, it's hot coffee. I like black coffee, and if I put anything in, a, just a touch of creamer or oat milk.
Oat milk.
Oat milk is good.
I love it.
I love oat milk.
Which mannequin is secretly your favorite?
Ooh, my pediatric mannequin. I'm
Aw, you're a peds through and
pediatric
through,
nurse,
right?
yes.
Most used phrase in the sim lab.
What happens in sim lab
Stays
stays
in
in
sim
sim
lab.
lab.
You're stuck in the sim lab overnight.
Nope,
What
it's
three-
haunted.
You're stuck in the sim lab overnight. What 3 things are you taking with you?
Snacks,
Mm-hmm.
my phone,
Okay.
probably my husband because I'm going to be scared.
I mean, that's fair.
I'm going to be scared.
Yeah.
I get scared when I come in
I
here
mean,
if I'm
it's-
the first one in the building. In the
Oh, yeah.
mornings.
It's kind of creepy. You're like, okay.
Yeah.
Well, a lot of people are afraid to go into the sim lab. A lot of our environmental workers don't want to
Mhm.
empty the trash
it
because
freaks them out.
they will only empty it if I'm in there. Or,
Oh.
a lot of people who don't have experience in the sim lab
Sure.
are very afraid to be in there alone. Overnight, I think I am too.
I mean, no, Kelly actually told me a story about seeing.
Kelly is convinced.
She's convinced there is something in the skills lab.
Ooh.
I won't go. I will go around and unlock and turn the lights on rather than cut through the supply room to go to the
I'm
skills
going to have
lab.
to pay more attention
I've
now.
only had a few little weird things happen. The weirdest thing that happened was I was here early one morning by myself, getting ready for the pediatric sim, and I was turning the simulators on, and the oxygen meter on the wall just shot off the wall.
That is creepy.
Because we have no gases running on those.
We do. So
I like
on
Ooh.
those we do because before this was a sim lab, it was like the student health center. So on one wall there are gases.
Was that the one that
There was-
spit up?
Yes, there were
Okay.
gases there, but I've never seen it happen
But we
before
don't-
then or after then.
Regulation of the gases though, so there would be no reason why
There
it
was
had
no
been
reason,
bothered.
Right. It just blew off the wall.
That's correct. Okay.
But that really I've not had any hauntings.
She
I'm not
just knocked
interested.
on
Yeah,
wood.
not interested
I
in
mean,
having any
Kelly, like she scared me to death when she told me about it. Yeah, she said she saw like a little light, and then her body got really cold, and then it just kind of got really warm. I mean, it's bizarre. I'm like, and then she told me the skills lab, or that it used to be that where students came to be seen.
Mm-hmm.
So I mean, you never know.
You never know. All right, last one. One word students would use to describe you.
Oh, just based on surveys, non-judgmental.
Oh, that's a good one.
Yeah, yeah, I can see that. Absolutely.
What do you wish the word was?
Brilliant.
You are, though.
She
You
is.
are.
She was the work wife that I would drag into the room going, double check this with me. My brain's not really, I don't know. And she'd be like, "It's fine."
It's fine.
I've seen her have a 2-year-old on TPN and lipids with a pole, do 15 other things at one time.
That's amazing.
He was so sweet. I miss him.
Yeah,
I
that's
know
her.
exactly who you're talking
Yeah,
about.
yeah.
He was my baby.
Apparently he's doing really well.
I'm sure he is, but
Yeah,
I'm
he,
glad
Rachel took care of
I'm
him.
sure he is because I took care of him.
even if she wasn't taking care of him, she would go take care of
I
him.
love that baby.
She loved him so much.
I do.
Yeah, that's the greatest thing about peds is
I
that we
know.
could just hold them up at the nurse's station. Like those little babies that don't have any parent. Like we would literally hold babies.
I love it.
Yeah.
That's not my jam, but I love it.
Yeah.
I appreciate y'all.
Well, you can keep your JJ stuff. I'm good over here.
Closer.
No, good.
Well, this is the fastest. This is the best. I'm going to have so little editing to do on this.
I know, so
Thank
excited.
you.
You're welcome.
Thank
yeah.
you. You've
Yeah,
been
yeah.
the best
Having me.
interview.
Yeah.
You know, I love to be on camera.
Yes, you do.
No,
Yes.
I really love the
Yes.
spotlight. So this
So
is the best.
excited. We've had to calm her down.
Yeah.
She's been so I'm
Yeah,
kidding.
this is- yeah.
She doesn't like the spotlight, but she needs to be in
Well,
it
yeah.
more because
You're amazing.
Well, thank you.
you're so
Yes.
behind the scenes so often.
That is true. You're never
That's
the
where I
face
belong.
of it.
That is where I belong.
Please.
That
You're
is-
gorgeous. You're
that's-
brilliant.
I think
you're
her
all the
face
things.
needs to be on the door.
Yes.
Yeah.
We can make you
No,
one.
I'm
We'll get
okay.
one for you. I'm on it.
Yeah.
Don't even
I'm
worry
okay,
about
I'm
it.
okay. Thank you. Thank you.
So thank you for everything you do for this program. You are truly amazing.
We're lucky to
Kennedy-
have
yes,
her.
Kennedy and I are so grateful and thankful for you. And I think I speak for all faculty and students alike. So thank you again for joining us on Pacer Nursing Power Hour. As always, follow us on all the social media outlets, Instagram, Facebook, Spotify, Apple Podcasts, and YouTube. And if you can't find any of those, hit up the USC Aiken website and you can find our links there.
On the School of Nursing page.
Yes, thank you. And
You're welcome. You always forget that one.
Mhm.
Okay.
Once again, thanks for scrubbing in with us.